Hi, this is Dr. Donald Pelto. I want to talk to you quickly about preventing falls and foot wounds in diabetics. So I want to begin by showing you a little bit about the diabetes toolkit that I put together for you and the preventing falls and foot wounds in diabetes. This is actually a website that I put together that you'll have access to. You just click on this little center part and you can get all the information that I put up here on this. So let me kind of show you where this takes you. So it's going to actually open up a page similar to this. This is all the information. This is a copy of the presentation, the diabetes toolkit here, foot pain toolkit, some balance forms, and a balance risk assessment. That's all we're going to talk about during this presentation. So let's kind of go on here and talk about a little bit more. This is the assessment, and so let's talk a little bit more about preventing falls. So what's the leading cause of injury and deaths among older adults? It's actually a fall. This is the leading cause of injury, and so we want to learn about how we can avoid falls in different types of patients and different types of people. But really, when you fall, what are the main parts that are injured? Most people have heard about the hip, right? Your hip can become injured, but as well, besides your hip, which can look like a fracture right here, you can also injure your hand, and you can also injure your head. Both of these are areas that are of great concern if you have a fall. Where do falls occur? Most people think that falls happen mostly outside of the house. The truth is, most of the falls happen inside of your house. So if you're going to try to prevent having a fall, the fact is you want to try to prevent it inside of your house, and the main reason is because most of our time is spent inside of the house. So you need to look in your bedrooms, living rooms, kitchens, bathrooms, hallways, and look at different types of things that you can do to help prevent that from happening. Outside or near the house is where 23% of them happen. So most of the falls happen outside, right around your house, or inside of your house. Why? Because that's where you're at most of the time. So let's look at some of the risk factors that you may have. So some of the risk factors people can have that can make them more likely to fall. The first one that we're going to talk about later on about the diabetes is actually neuropathy. Neuropathy is a condition where you lose the feeling in your foot. So if you look at this foot right here, there's certain test points that we can test with this little monofilament, and we can see how your neuropathy is. If you have neuropathy, it's going to make it worse for you, and you're going to be at greater risk of a fall because you can't feel your feet underneath of you. Also, if you have ankle instability or weakness in your ankle. How many people have heard of, well, I've twisted my ankle or I've sprained my ankle? Something like that can cause you at greater risk for fall. And as well, weaknesses. If your muscles or your thighs or your legs are weak in any way, you're going to be at greater risk of a fall. Vision problems, poor eyesight, retinopathy, glaucoma, all those, if you can't see where you're going to go, you may fall. I know a patient recently, he actually had a problem where he was going into a doorway and he couldn't see his feet. He had a problem where he couldn't look down, couldn't see it, and he actually tripped over the doorway, and it made him a greater fall risk because of that. Also, different types of foot deformities, like bunions, hammer toes, and different types of painful feet. But let's look around you. What can be around you that can be a risk factor? Well, let's look at some hazards that can be around you. For example, water, ice, but most importantly is a rug. Inside your house, rugs are one of the biggest reasons for people to have falls. So make sure if you have rugs to take them up and don't put them down. And also if you have any water or anything dripping on the floor, pick that up and you could very easily fall on that. Also, different types of obstacles in the floor. If you have a lot of different furniture, things like that, this can be a greater risk of a fall. There's also other things that are related to you that can make you fall and give you a greater risk of falling. For example, different types of side effects with different products, such as high blood pressure medicine, seizure medicines, diabetes medicines, emotional problem medicine, and then pain medicine. All these medicines can help you lose your balance and make you a greater risk of a fall. And as well, improper shoes. If you have the wrong types of shoes, shoes that are too small, too big, or long clothing, all these can make you a greater risk of falling. So let's look at exactly where they happen, what are the causes of falls. Most of the causes are an accident or something in the environment, like slipping on a rug, and then next down is due to balance disorders. This is due to dizziness and other types of things, visual problems. So the biggest ones, if we can affect it, would be to help with any accidents and then also with your walking. As I mentioned before, there was that pamphlet on that other website that I'm giving you that you can learn about those things specifically. And also gait and the balance disorders. That's what we're going to focus mostly upon today. So what should be in a fall risk plan? Your risk plan should be some type of an assistive device, such as a cane or a walker, some type of physical therapy where you can evaluate how your muscles are, if you need to strengthen your muscles and improve your muscle strength, and also your primary care doctor, looking at how your medications are and if there's any need to change, and then also podiatric or a foot evaluation to see if there's any foot problems. Now, one of the new technologies I just want to talk in passing is a new brace that's been invented. It's called a More Balance Brace. What this is, it's just like an orthotic that goes underneath your foot and it goes up the back of your legs, and this can help you have increased balance. It's something that's easy to put on, it's lightweight, it helps with your foot clearance, and it's made to help you recognize where you're at in space, and it eliminates any of the abnormal motion. Who really could benefit from these? Really anyone that can say yes to any of these problems. Have you fallen in the past? Do you often slip, trip, or have near falls? Do you have a fear of falling? Do you drag your feet? And do you have to touch on or hold the walls or furniture when you're walking? So those are all questions that you can ask. So let's go on to the next section. This is going to be on preventing diabetic foot problems. So for people that have diabetes, the biggest problem we want to avoid is a foot sore. Here's another example of a foot sore, and also these conditions that your foot can lose the feeling and create a big kind of a collapsing foot. This is called a Charcot foot, or even have a sore. The whole goal is to prevent the sore from going down into the bone. Okay, this ulcer that goes down as it goes down into the skin, it's very, very close to the bone. Why is the second part important? Everyone understands about falls, but sometimes people don't understand about foot wounds. What's really important to know is that 1 in 4 people with diabetes get ulcers every year. So if you look at 100 people, 4 of them will probably get a sore or a wound. About 15 or 25% of people will get one in their lifetime. So that's a pretty big list of people. So someone's going to get them. 50% of these lead to amputation. So if you have an ulcer, 15% you lose your foot or your toe, and then 85% of amputations start as ulcers. So pretty much everyone that has an amputation, the majority of them, they start as an ulcer. A lot of the other amputations happen due to different types of war events or different types of tragedies that happen around the area. Let's tell you about a little story. This is a patient of mine. She came in, I saw her in the emergency room. She had this redness in her foot. She had a big sore on the bottom. And this sore actually started out as a callus. This is a callus and this is a sore. If this callus gets too big, it breaks down the skin and it creates a sore underneath it. This sore got infected. And she came into my office, and she didn't have this. I saw her in the emergency room. I treated the infection, and it took a couple of years for that wound to heal because we had to do multiple surgeries to get it to close. We used a wound vac on there. We did a lot of other treatments, and eventually we had to remove another sesamoid bone that was affected underneath that joint to get it to heal up. But the weird issue, the interesting issue, is that her husband as well had diabetes, and he was taking care of her, and he didn't mention it, but at the same time I was treating her, he ended up having gas gangrene and losing his leg. So it's very, very serious. Having a sore or having an amputation are serious things. So I want to talk about 3.5 ways to prevent a foot wound. Okay, so let's begin. So the first thing you can do is look at your feet every day. If I could tell you that there's one thing that you could do for the rest of your life and probably prevent an amputation, it would be this: look at your feet. If you can't see your feet due to some type of a problem, you can't see down there, use a mirror. Have someone else look at it for you. Have one of your grandchildren or parents or children or someone look at it for you. Okay, so look at the bottom of your feet. What are you looking for? Anything that looks different. Any redness, any signs of cuts, any bruises, anything like that. As well, wear the correct size shoes on diabetic shoes. Not all diabetic shoes are ugly, but you have to really make sure that they're the right size, because if they're too big, they can cause friction. If they're too small, they can cause injury to your skin and cause sores. I see problems every single day from people that wear shoes that are the wrong size. They tend to be doing work around the house and other things like that, and they're just not really taking care of their feet. Also have a professional trim your calluses. I see so many people that come in and they have these calluses that happen, and they try to trim them with their pet egg or some type of a razor. Don't do it on your own. That can cause problems. And when you do see a foot doctor, if they remove the callus and there's a sore underneath it, they usually, everyone sometimes thinks, oh, my doctor caused it. Well, your doctor didn't cause it. It was under there, because what happens is that callus gets thick and it breaks the skin underneath it. And then the last thing you can do, the 3.5, I put 0.5 because I think this is the most important thing, is for you to take responsibility and learn more. There's a lot of resources out there. I put this resource, this diabetes toolkit. It has helpful information about every aspect of diabetes that can affect you. Just general information, of course. That can be found at drpelto.com. Have a yearly foot exam. Have a doctor look at your foot every visit, no matter what doctor you're seeing. And probably not for the eye doctor, but your general care doctor, have them look at it. And also look at the diabetes toolkit. Okay, but a diabetic should have a foot exam at least once a year. Now I want to talk quickly about 4 reasons why foot wounds don't heal fast. So a lot of my focus is on healing foot wounds fast, and I actually learned this from one of my colleagues, Dr. Knoyer, and he's a local podiatrist, and he always told me there's only 4 reasons why foot wounds don't heal. So I'm going to talk about these 4 reasons. So if you develop a sore and it's not healing as quick as you think, look at these reasons. The first reason is poor blood sugar. If you have your blood sugar that's elevated, your hemoglobin A1C is over 7, that's an area of concern. So sometimes people come in and have an 8 or a 9. That shows that your daily readings are about 275 or 240. So those are really high readings. So to take care of your blood sugar, that may be your nutrition, that may be your medications, but that should be taken care of. Also, look at your blood flow. If you have poor blood flow, that can slow down healing. If you have clogging in your arteries, like we see right here, this clogging can certainly cause that. There's an exam that we do here called a peripheral arterial exam, where we actually look at the blood flow in the area to make sure the flow is good right here, like these ones. And you see how this one's straight lined? Well, you don't like straight lined, so that would show that there's poor blood flow in the toes in this picture. And also take care of any swelling. A lot of times if you have swelling, it can slow down healing. I had a patient recently that has sore on the toe, and this patient wore compression stockings that went to this area, and there was a lot of swelling in the toes. And because of that swelling, that wound didn't heal. Once we stopped using those compression stockings, that wound healed up for them. Look at neuropathy. If it doesn't hurt, doesn't mean that there's not a problem. A lot of times patients with diabetes, they walk on their feet, they walk on a sore, and it doesn't heal because it doesn't hurt them. And so they think they don't have to stay off it. Really staying off it is the most important thing if you have a foot sore. And then if you have a deeper infection is something that can happen to anyone, but it may go unnoticed. It may not look infected, it may not look red, it may not have anything coming out, pus or drainage, but if you find a wound is open and then it's healing a little bit, and then opens up again, and healing, and then opens, we want to get an x-ray or an MRI to make sure that there's no deeper infection in that area. And then lastly, here's some information in this diabetes toolkit that I put a link to. This is kind of helpful for you, this toolkit. Let me just take you there and kind of show you what you're going to find there. This is the page that I made for you all. It's called Preventing Falls and Foot Wounds and Diabetes. And in this page, it has this lecture. It's going to have the recording of this lecture as well. A foot pain toolkit about just different foot problems that people have, the balance information. And then this is the diabetes toolkit. If you click here, it's going to actually open up to a diabetes toolkit that has information on diabetes, a little introduction, about feet, about sores, about basics of diabetes, such as type 1, type 2, things like that, how to manage your diabetes. If you go back, you can learn more. Your medications, weight loss. Here's a couple of good videos I like on eyes and on diabetic retinopathy. And if you just click that, what it's going to do, it's going to pop up a little box for you, and you can certainly watch this animation that talks about how retinopathy is formed in your eyes and different types of foot problems, different types of eye problems like that. And then there's kind of some good stuff on weight loss and medication. So these are all resources I put together all inside of this Preventing Falls and Foot Wounds and Diabetes. And you can certainly get this. It's real easy to get to. All you have to do is go to drpelto.com, and if you don't have access to it anywhere else, if you go to my website, I'll show you here. It's pulling it up, and then you hit this diabetes toolkit right here on my blog, and you click there, and that'll just kind of open up that the diabetes portion, just like that. Okay. So that's how that works. So I hope you found this helpful. If you want to learn more, once again I gave you the link here, drpelto.com. that has a diabetes toolkit in preventing falls. If you want to email me if you have any questions or anything to add, please do so. If you'll want to make an appointment in our office here in Worcester, do so as well, 508-757-4003. Okay, thank you.